TIDES stands for Tackling Inequalities and Discrimination Experiences in Health Services, showing the impact of discrimination on health and other outcomes, other social outcomes. In TIDES Phase 1, that involved looking at the role of bias in clinical decision-making. And in TIDES Phase 2, where we were looking at the sort of identifying and mitigating the impact of the pandemic on racial and ethnic minority groups, we wanted to allow people's stories to become a part of the training and education in a way that took away the emotional labor and the physical labor of having to repeat what for some have been, examples of lifelong exposure to discrimination and racism.
So the virtual reality approach is based on this idea and the findings that if you are in a virtual reality environment, your body responds as if you were in a real environment. We use videos, so 3D videos, to recreate situations that people who are at the receiving end of discrimination go through in their day-to-day life at work.
At the moment, we've got 3 scenarios. They weren't just plucked from the air, they were based in the stories that we've had in terms of people that have contributed to TIDES, because TIDES is a mixed methodology. It's both quantitative and qualitative, so quite in-depth interviews from people, a variety of professional backgrounds within the health service, and talking about their different discriminatory experiences. Building that, having script writers to stay true to the story, but also to lend itself well to being in a VR setting.
So the project is called Walking in the Shoes of, and the idea is to make people feel like they're actually in the shoes of someone else in one of those situations where that will, in theory, enable a more in-depth conversation later when we have the structured debriefs.
It's very difficult to be in a position where you're having to tell your story all the time, because that's almost traumatising and re-traumatising. So actually having the VR application is really helpful because A, it gives people the experience, the learning experience, but most importantly, certainly for us, is that it's then the platform to think about how might we want to do something differently.
From a theoretical point of view, the fact that you have a lived experience of something should enable you to learn how to tackle this type of situation faster than if you're only told or you only read it.
What the research shows is that when people are emotionally engaged, it seems to embed itself or last longer.
It's really important for us that we capture not only the experiences of discrimination and racism, but also what it's like to witness those experiences. We want to see the dial move. And so what we want to do is make sure that this is properly integrated. So not just as a tool of research, but actually something more practical.